Welcome to the Talking HealthTech podcast. My name is Peter Birch. I'm here at Australian Healthcare Week 2025 in Sydney. Here on day one at Australian Healthcare Week, I was chair of the digital health stage. And on day two, I'm here on the expo floor with Sophie, our co-host, and having conversations with speakers, exhibitors, and other people attending Australian Healthcare Week to bring you this feature episode today. Some of those conversations are featured in this podcast that you'll hear in a second, but to catch all of the discussions that we had here at Australian Healthcare Week, head on over to our YouTube channel. There's a special playlist featuring them all back to back, and you can get that in the show notes of this episode. Collaboration starts with a conversation, Team HealthTech. Let's make it happen.
So I'm Emily Males. I'm the Chief eHealth Strategy Officer at the Department of Health in Victoria. And my job is to set the strategic agenda for digital for the Victorian healthcare system. And I also look after cybersecurity.
Cool. What brings you to Australian Healthcare Week?
So it is always good to come to these big healthcare conferences. It's been good walking the floor and seeing what's new and how things have progressed since last year. But also, I've got a few talks. Yesterday, I did a masterclass on cybersecurity awareness and raising that awareness in your workforce. And then in just a few minutes after this, I'm doing a talk on the next 10 years for digital investment in Victoria.
Very cool. Hey, I just thought then, as tying together both cybersecurity and the digital health strategy, it's interesting that those two are kind of all part and one of the remit. Is it important that cyber is kind of called out separately? Because some people might think, I guess cyber is just part of the strategy, or it's just one element that we do. Why is it so important that those two things are part of the one?
Well, for me, it's because there's also a massive operational component of cybersecurity. So running, monitoring, we've got a 24/7 operation, making sure that ideally there are no incidents, but if there is one, it's picked up really quickly and managed. Whereas the digital strategy component of my job is like I exist 10 years in the future.
Yeah.
And it's not super operational, although I work closely with the other branches in eHealth that are really focused on delivering what the strategy is. So that's why I differentiate.
Cool. And there are e-healths in other states of Australia, and it's interesting seeing the direction that those states are going when it comes to digital. What's the direction for Victoria?
So we are just now setting our 10-year vision and plan for investment in that capability and digitally enabled care. And the next 10 years will be fascinating, right? So technology is advancing really quickly. There's a whole bunch going on globally. Even things like venture capital in digital health is now on the rise again. It had a bit of a slowdown after COVID. And so the next 10 years from a strategy point of view can't be linear. So the approach that we're taking is focusing first on the outcomes we want to achieve in 10 years, not technology outcomes, but system outcomes, patient outcomes, workforce outcomes, being really clear on those, and they're shared and everyone can galvanize around them, and then being really adaptive in how we might work towards them. So shorter term roadmaps and action plans that sort of take us closer to that vision, but also developing delivery models that are moving away from the big bang sort of 2, 3, 5, 10-year IT programs, but actually making that much more incremental and as much as possible making it a BAU capability. So we're always improving our digital maturity.
Yeah, that's. I feel like that's important sometimes too, to be able to deliver here's examples of what success looked like along the way, and if you can bring people through on that journey and be part of that where we're heading, but have those incremental wins along the way, that's super important. I'm also interested too on the healthcare for everyone globally over the next 10 years is going to be pretty wild, and it's interesting looking at not just what we're doing in Australia, but also overseas. Are you looking abroad as well about what's happening in other parts of the world and how they're doing health?
Definitely. And what remains true is that no one's cracked the nut on how to deal with the immense pressure that the system, particularly public healthcare systems, are under, but even some of the big, money-laden private healthcare organizations in America, there's still inequity in their regions. They haven't fully solved it. And so I think it's about taking that grain of salt when you look globally. What are the great models that we can learn from, but how do you translate it into our context? In Victoria, we have over 70 organizations that work together to deliver healthcare. It might not be as easy for us to adopt a model that's been successful in South Australia, let alone Scandinavia. So it's really about understanding what are the what outcomes do we want? What capabilities do we need to get there? And then what's the most effective way to build them based on our context?
Yeah, that's going to be important. Lastly, before I let you go over and do your session on the stage shortly, what are you hoping people take away from the session that you're about to deliver?
So there were 3 takeaways that I've got in my talk. The first one is that the future will be different. And we need to plan for it. So the way that technology is advancing, technology is becoming much more pervasive in our lives, that's speeding up.
Yes.
The second one is, I'm testing myself now. The second one is in an environment of constraint, we have to focus on the quick wins and the leapfrog opportunities. So moving away from that linear progression, because we'll just never get there. And then finally, and most importantly, sort of the main point I'm trying to make is that long-term value requires scale. And most of our investment in digital is subscale, and that's why it's not addressing those system pressures to the extent that we need it to. And so our next 10 years in Victoria is all about figuring out how do we unlock that scale so that we are reaching that sort of that sustainable healthcare system that we need to get to.
Hey, Ed Marx, CEO, Marx Advisory.
Welcome to Talking HealthTech. It's nice to have you on the show.
Man, I feel like I finally made it. You know, I've been coming to this show as my second year, and I saw everyone the first year that I was here, and I was so jealous. And I saw that magic bus behind me, and I was like, please have me on the show, and so thank you.
Oh, it's so nice to have you on here finally.
I know. I'm so ecstatic.
Yeah, amazing. So tell me, what have you been talking about today at Australian Healthcare Week?
So I got to talk about my favorite topic, so I'm doing 2, and I already spoke at my keynote on patient experience. And then I'm going to do a master class really on how to engage the workforce in digital transformation. But the keynote was really about patient experience and, 5 things any leader can do in their organization to improve patient experience.
And I love you mentioned before we hit record that 4 of those actually don't require any money. And I guess that's the biggest thing is when we look at patient experience, a lot of it is a nice to have and it feels a bit soft.
Yeah.
But tell me more about what we can do without having to have a budget line.
Yeah, for sure. Yeah, the biggest defense, and I get it completely, is I don't have any money. We don't have any money. We don't spend any money on it. So I always say, okay, do this first 4 things and the money will happen. And I can give many examples of how that is. But, one of the things is to create a culture of empathy. So all the things that I talk about seem really simple, like, oh, we do that already. But then when I really go a little level deeper with people, we really aren't doing it for the most part. So creating a culture of empathy. So I just give like 3 or 4 ideas, and there's many more in the book. 3 or 4 ideas anyone can do to create such a culture. So you probably want to know, what's one example? One example is instead of you speaking, like if you're the leader, instead of you speaking at all of your town hall meetings or whatever you bring your teams together, always have a patient as a speaker. Because it's one thing for you as a leader, they sort of expect it, that you're going to say something positive like rah, rah, and what's our why. And that is important of a leader to do. But it's even more powerful when it comes from a patient. So at every meeting, we have a patient that starts off the meeting, and they talk about how technology helps save their life or improve their experience. I mean, I can tell you so many stories. They're mostly tearjerkers, and it really touches people's hearts, and they get it. Oh my gosh, I'm so glad I serve here. I get why we do it. Oh, I'm ready to go and do more.
All right.
Yeah.
So a culture of empathy. What else have we got?
So another one is to run IT as a service, not a process. So that's antithetical to what we're being taught today with Lean Sigma, Six Sigma, process improvement, Gemba walks. All those are great. So I'm not discounting those at all. But I think we went overboard to the point that we've basically taken everything that we do and stratified it into, okay, we do radiology, we do lab, we do nursing. And so we get really good at radiology, and we got all this perfection in terms of the process of radiology, but we don't keep the bigger picture in mind with the patient. So the patient, they're going from radiology to lab to see their neurosurgeon. So you may be perfect in radiology, and so I can give you so many examples, but the patient goes, they have to be transported to an appointment, takes a couple hours, costs money, and they go there, have a good experience. Then they go back. The next day, they got their lab appointment, and it's the same thing. And the next day, the third day, they go to see their neurosurgeon. Well, think about that from a patient perspective. Oh, it's horrible. They had to make 3 different trips, 3 different specialties, when it could have been 1 trip. So if we stop looking at things like as individual processes, but services, across the continuum, it makes a huge difference. And it's not that hard to do. So one of our differentiators, one way that an organization can actually improve their revenues by offering that as a service and say, hey, we're one-stop shop. You come in and one day you'll have seen all the different specialties and you'll have your final, meeting with the clinicians to review all the results same day. I mean, think about that.
Yeah, amazing. Just totally change that up. So I want to dive then into your keynote, which is all about digital enablement. And I suspect that those two link a little bit together. Can you tell me a little bit more about what you'll be talking about in that session?
Yeah, so we'll be focusing mostly on the workforce aspect. So how do you get the workforce really engaged to have digital transformation? Because here's what I believe, that you cannot have digital transformation without personal transformation. So it's kind of funny. You have all these leaders talking digital transformation. We're going to change things. And you look at them, and it's not a judgment, but you have to do the reality check. You look at their lifestyle and you look at maybe their work style, and there's no transformation. So how do you expect? So a really simple example from many years ago, you'll see this is a dated example, but it's a very clear one, where I was driving digital transformation for our organization. And my naysayers, my fellow individuals on the C-suite that were putting the brakes on all these different cool things we were trying to do, were the same ones when I travel. I'd see them and they would use paper tickets, right, to get on the airplane. They would print out their baggage claim tickets. Everything about them would exude old school. But yet they were trying to tell me and tell my team how to do digital transformation, how to do next generation of apps, as an example. But they themselves did not do apps. Or so I'd be like, a more contemporary example would be, all right, so a lot of things are apps and a lot of our engagement. So I'd say, okay, can I find you on TikTok? And they'd be like, what, TikTok? Okay, what's your Instagram handle? Instagram? How about X? How about, maybe they had LinkedIn. But these are the same individuals that are telling you, oh, don't do this or do that with the latest app, but they don't know. So again, not a judgment, but an opportunity, therefore, to adopt these things. I'm the same way. I don't, what kind of time do I want to spend on TikTok and Instagram? But thankfully, I have kids of that age, and they're all younger adults now, and they help train me, and I adopt it, and they sort of force me. And that's why I'm able to lead and have led digital transformation, because I've transformed myself.
Sure, that's a very key takeaway there. I know for me, when I was sort of transitioning from the clinical space into digital health, I had to really work out how to leverage LinkedIn and what that actually meant, because as a clinician on the floor, it's not something that we use. But certainly digital enablement and transformation, it needs to be at all levels. Yeah,
and that's the other thing I encourage people, and everyone could do it. They don't have to have a clinical background. It's great when you do. I always hired my teams that at least 25% had a clinical background, such as yourself. What about the rest of the individuals? So I try to expose them as much as possible to the 25% on the team that were clinicians, but I also had them think about, I would never force any of this on them, but think about, because I did them myself, so I led by example, volunteer every week. So volunteer and be in a patient care setting, so you see patients and you see clinicians. I would do these programs that they did have to comply with, which were shadowing programs. So if you were a director above, every month you did rounds, clinical rounds. If you were just a non-director, everyone else, you had to shadow a clinician one full shift per year. And it was a great program. They could switch up where they went, which hospital, which service. Maybe they wanted to spend time in the OR, maybe shadow a nurse. And they had to do that, report back. And you do that year over year over year. Encourage volunteerism, have the patients as presenters, have clinicians as presenters, shadow, do all these different things. It transforms people. And that's when you get transformation.
Amazing. Well, some very rich insights there, Ed, for our listeners and also for those at Australian Healthcare Week. Thank you so much for your time.
Thank you for having me.
Pleasure.
Now can we ride the bus?
Absolutely. I'll take a photo.
River Nygryn. So I'm the Chief Information Security Officer at Hammond Care. Been there for about 2 years. Prior to that, I was at Macquarie Bank and Ramsay Health for almost 5 years as well.
So good, thank you. And what brings you to Australian Healthcare Week, River?
So I was speaking yesterday on a panel discussing third-party risk and supply chain risk.
Excellent. And well, I was moderating that panel, so I knew that. But so it was interesting looking at that discussion and leaning into third-party risk around cybersecurity. For those who might be unfamiliar about like what that framing would be, tell me a little bit more about that and why it's important to focus on it.
So there's been recent attacks where, your third party might be affected and it actually has knock-on effects to your organization you might not be aware of. So all those types of things that can come up from, a third party not keeping up with security controls, not making sure that they're mature in their security strategies and keeping up to date can have those impacts on your business. And that's not immediately clear. So making sure that you keep those relationships fresh, current, and have those constant conversations with them is going to mitigate your risk of anything that could happen to those organizations.
Yeah, right. So rather than, there being a direct breach in your own technology or infrastructure, given that we're in a healthcare environment where we want systems to integrate and you want to work with partners, and so if there's another vendor that you're working with, that third party then has an issue, then there's potential for to have compromises upstream. So you don't want that. Tell me a little bit more about cyber then generally around Hammond Care and the work that you do and what's super important at the moment.
Well, in healthcare, it's all about data. So data is super critical. A health record is essentially immutable. So it can't be changed. Once it's out there, you can't go and change it. Someone gets a hold of your credit card, within 72 hours, the banks are changing that number and it's obsolete. Health record's very different. Had a personal story of a family member, her health record was leaked. And identity theft happened. She couldn't get a loan for 2 years.
Wow. That's hard. And so where are your priorities at the moment in the work that you do at Hammond Care?
Data in use and in transit. So DLP is critical. We've got a system in place for that at the moment, and we're just going through what we're seeing, how our staff are interacting with data on a daily basis, and then working out whether or not those processes are something we want to allow or something we may want to block.
Got you. And lastly, quite a good mix of the healthcare ecosystem here at Australian Healthcare Week, and a good breadth of sessions happening yesterday, including yours and today as well. What are you hoping that people will take away from some of the sessions today? Because there's a good amount of cybersecurity yesterday afternoon, but a lot more too. What would you hope that attendees would take away?
The big one is maintaining those human relationships with your suppliers, your third parties, ensuring that you kind of bring that human element to them, pick up the phone, have the conversations, maintain that. But then the other thing as well, I was listening to a session earlier about how smartphones are becoming more and more advanced in the medical space, and they're becoming almost medical grade equipment themselves. I think we need to be really careful and have our finger on the pulse around what's happening there and all the different settings that mobile phones could potentially have and what risk that introduces into your workforce.